Hi, we're here with Dustin. He came in today to see Dr. VanNoy. Dustin, will you tell us what you came in today for?
Absolutely. A few days ago, I woke up with just stabbing knee pain. I wasn't sure what I did, but I had no mobility, had nothing but pain, couldn't get in and out of a car, couldn't lift my own leg, so I had to do something. So I came to see um, Dr. Danny and Dr. Wards at Infinity, and I think it's worth mentioning that with the immobility, with the pain, that my stress level was through the roof. As part of the intake process, they ask you what it was, and my stress level was easily an 8 before the adjustment, before the treatment.
What would you rate your pain level at when you first came in?
A 9, only because 10 would mean I couldn't have got here to see you, so I got here, but it was excruciatingly painful.
And what did Dr. VanNoy do?
There was an intake process, some muscle testing, some adjustments, some knee manipulation, knee adjustment. I had some acupuncture needles also.
And what would you say the pain level's at now?
After standing up, that's not on video, but after standing up, doing a few movements, doing this, pulling my knee up, being able to squat, the pain's probably a 4.
Great, good. And what can you do now that you couldn't do? You said you can pull your knee up.
I could pull my knee up. Before I couldn't have done that. I was pushing myself up with my hands and my left leg. I'm putting 90% of my weight here just to stand up. I couldn't bend much lower than this, but now, without supporting myself, it's a pretty good range of motion, and I definitely couldn't do this. And that was just 30 minutes ago.
Great, awesome. That was after just one visit. Thanks so much.
Thank you so much.